How prepared are you for healthcare costs in retirement? Have you thought about it? If not, it's high time to start. As we journey through life, the importance of planning for future healthcare costs becomes increasingly clear. With the golden years of retirement comes the freedom to explore new hobbies, travel, and spend time with loved ones. But let's not forget, it also brings with it a new set of challenges, one of which is healthcare costs. As we age, healthcare expenses naturally tend to increase, and often they become a significant part of retirement expenses. From routine checkups to unexpected medical emergencies, these costs can quickly add up, leaving many feeling overwhelmed and unprepared. But let's not get disheartened, rather let's face this challenge head-on. It's never too early or too late to start planning for healthcare costs in retirement. But don't worry, we're here to guide you through a step-by-step process to plan for your healthcare costs in retirement. Firstly, understanding your Medicare options is crucial. Now let's dive right in. Medicare is a federal health insurance program primarily for individuals who are 65 or older. It can also cover some younger people with disabilities and those suffering from end-stage renal disease. Medicare comprises several components. Medicare Part A, often referred to as hospital insurance, typically covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Then we have Medicare Part B, or medical insurance. This part covers certain doctor's services, outpatient care, medical supplies, and preventive services. Moving on, we have Medicare Part D, which adds prescription drug coverage to the original Medicare, some Medicare cost plans, some Medicare private fee-for-service plans, and Medicare medical savings account plans also fall under this category. Lastly, we have Medicare supplement insurance, also known as Medigap. These policies are sold by private companies and can help pay some of the healthcare costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Now, why should you explore supplemental insurance plans? Well, while Medicare will cover many of your healthcare costs, it doesn't cover everything. For instance, some services like long-term care, routine dental or eye care, dentures, cosmetic surgery, acupuncture, and hearing aids are not covered by Medicare. That's where supplemental insurance plans come in handy. They can help cover the gaps in your Medicare coverage and protect you from unexpected medical costs. In conclusion, planning for healthcare costs in retirement is more than just signing up for Medicare. It's about understanding the different parts of Medicare and how they work together. It's about realizing the gaps and planning for them. It's about exploring supplemental insurance plans to ensure that you're covered for the unexpected. Remember, understanding Medicare and its various parts is the first step in planning for your healthcare costs in retirement. Scene script. Next, consider the option of long-term care insurance. This form of insurance is designed to help cover the costs associated with extended medical care that may not be covered by traditional health insurance plans or Medicare. Long-term care insurance can include coverage for services such as in-home care, assisted living, adult daycare, respite care, hospice care, nursing home, Alzheimer's facilities, and even modifications to your home to accommodate disabilities. As you navigate the golden years of your life, you may find that healthcare needs increase or change. These changes might require more specialized care or assistance with daily activities, which can quickly become costly. That's where long-term care insurance comes into play. It's a safety net, a shield against the unforeseen. Many people in their 60s start to consider long-term care insurance as part of their retirement planning. And there's a good reason for this. The cost of long-term care can be staggering, potentially eating into savings and retirement funds. It's an aspect of retirement that, while not pleasant to think about, is crucial to consider and plan for. Long-term care insurance works by reimbursing policyholders a daily amount for services to assist them with their activities of daily living. You can choose a range of care options and benefits that allow you to get the services you need where you need them. This insurance is not just about covering costs, it's about choice and control. It's about being able to decide where and how you receive care, preserving your independence and maintaining your quality of life. But remember, like any insurance product, it's essential to understand the terms, conditions, and exclusions before you buy. Each policy is different, and what works for one person might not work for another. It's about finding the right balance between your needs, your budget, and your peace of mind. In summary, long-term care insurance is a valuable tool to consider in your retirement planning. It helps to safeguard your savings, provide options for your care, and ultimately, give you peace of mind. Long-term care insurance can provide peace of mind knowing you have coverage for potential extended medical care costs. To wrap up, planning for healthcare costs in retirement doesn't have to be overwhelming. It's simply a matter of understanding your options, making informed decisions, and preparing for potential outcomes. Let's take a moment to revisit the salient points we've covered in this guide. We delved into the world of Medicare, a fundamental pillar of healthcare for retirees. It's crucial to comprehend the different parts of Medicare, what they cover, and how they can serve your healthcare needs in retirement. It's a system designed to provide a safety net, but it's not a complete solution. That's where supplemental insurance comes into play. Supplemental insurance, also known as Medigap, bridges the gap between what Medicare covers and what it doesn't. It's an additional layer of protection against unexpected costs that could potentially shake your financial stability. Think of it as a contingency plan, a buffer against the unforeseen. It's not mandatory, but it's definitely worth considering if you want to fortify your financial security in retirement. Then we explored the realm of long-term care insurance. As we age, the likelihood of needing extended medical care or assisted living increases. Long-term care insurance is designed to alleviate the financial burden that these services can impose. It's a safety measure, an investment in your peace of mind. Remember, the goal here is not to predict the future, but to prepare for it. It's about creating a financial safety net that allows you to enjoy your golden years without the constant worry of healthcare costs. It's about ensuring that you have the resources to receive the care you need when you need it. With careful planning and a clear understanding of your options, you can navigate healthcare costs in retirement and pave the way for a healthy financial future. So what are you waiting for? Start planning today. Planning